Hi everybody, this is Azar, physical therapist. Today we're going to go over the problems of the lower back that are more serious, like disc injury and facet joint injury. Probably a lot of you guys having that problem, your MRI showing disc bulge, you get scared, you said what's going to happen, I need surgery, I don't need surgery. The answer is not totally clear, but we're gonna go ahead and show you a couple of the stretches and the ways that you can release the symptoms, usually the symptoms that going down to the legs, which we are more concerned about. And if you don't get better with that, you probably need cortisone shot or go to the surgery. But let's start from the exercises first. So you need to do daily stretches if you have a disc injury or facet joint injury or disc degeneration. Which causes pressure on your legs. Some people have numbness tingling down to the legs. Some people have shooting pain down to the legs. Some people have feeling of a tightness or spasm on the shin. So these are all problems that showing your disc injury is progressing. So first of all, we need to centralize the symptoms. So we're bringing the symptoms from the leg down to the back. If you have more back pain and less leg and shooting pain, we're successfully treating. So first of all, we're going to go through the sciatica stretch. Sciatica stretch is the most important stretch for you, which is the main key for you to be able to get rid of the symptoms. It can aggravate your symptoms first, that's normal, okay? So what I'm going to do, I'm going to go ahead and lay down and get a towel or belt or something and put it on the foot and bring the leg up and go ahead and stretch it as much as you can. Stretch with the knees straight, and you can bring your toes up and down, your ankle up and down, and floss that sciatica nerve. You can hold it for 30 seconds and do it like 5 times a day at least to get relief on that pressure on the nerve. So the next stretch you can do is going to be hip flexor stretch. Some people are bending forward so much, or their muscles are tight in the front. That can cause more pressure on the disc. So what we can do, we can lay on the stomach and bring the leg up, hold it, okay, and feel that stretch on your forehead tight. If you don't have enough flexibility, so again you can go ahead and use the towel or something. So grab your leg with the towel and pull it. If you don't feel enough stretch, what we can do, we can fold this towel, put it underneath your thigh right here, and then you can stretch like that, making sure your hips totally as much as possible on the floor. So these are the hip flexor stretch. It's a lot of other way of stretching your hip flexor or hamstring, but these are the safest for people with the back injury. But you need to do it slow, count to 30 seconds. If you have any shooting pain, really bad down to the legs, stop it. If not, it might be a little bit of it was okay because you are stretching the nerves basically with the muscles. So the next stretch will be your stretches of glutes. So we're going to stretch the glutes just like this. Okay, holding it to your chest, 30 seconds, relax. You can do single leg stretch for the glutes, and you can go ahead and do other leg stretch on the hip flexor while you're bringing that knee to your chest. So you're killing 2 birds with 1 stone, stretching this glutes and stretching that hip flexor and opposite. Okay? The next stretch I can show you will be the child pose in yoga. This is very appropriate for people with the facet joint injury, people that have problem extending. Some people when go to the extension, they get a lot of shooting pain to the legs. They have stenosis, narrowing of a canal, nerve canal, and facet joint injury. These people can really benefit from the child pose in yoga, which is going to be laying down, okay, and then bringing your feet like that, your hand all the way forward, trying to open your facet joint in the back of your spine. Hold it for 30 seconds and slowly bring yourself back up. What else you can do? You can do this one and go to the side. That's going to be a very good stretch at the same time for the side muscles of the opposite. So I'm stretching my left side oblique muscles now. Okay, now I'm going to go ahead and stretch my right side oblique muscle. It depends which side you have more problems. We're going to focus on that. Bring yourself back up slowly. For people that have disc injury, that might cause pressure on the disc, but for people that have facet joint problems and narrowing of a facet or narrowing of a canal of nerve, they might feel really good and release the pressure. Okay? Another stretch that I'm going to show you here is specifically for people with the disc injury. So you're going to lay on your stomach. We call it McKenzie. You probably heard about that. Very famous. You're going to bring yourself up straight as much as possible. Hold it there. If you don't feel shooting pain to the leg, that's appropriate for you. Again, if the pain is shooting to the leg, that's not appropriate. You can do it up to 10 times on that. Okay. Very good. The next important stretch will be your piriformis stretch. As we said, the piriformis muscle in the buttocks, exactly going on top of the sciatica nerve. Sometimes sciatica can get trapped underneath that tight piriformis. So what we're going to do, again, we're going to put one leg on top of the other leg, grab the opposite leg with both hands, pull it to your chest, and you're going to feel a stretch in your other side buttocks, in your right. Okay? You're going to do it this way. Now, you're going to feel on the left piriformis. You're going to feel the stretch in the left piriformis. Okay? Hold it 30 seconds. And relax. Very good. Now we can do a couple of the stretches of the pelvis, which is going to be the pelvic tilt. You're familiar with that. We already talked about it. So now we're going to do it in different position, in the quadruped position, okay? So what we're going to do, we're going to go like a camel and cat. Camel and cat. Camel and cat. Camel and cat. Okay? This is going to be very effective pelvic tilt exercise, which you hopefully you're going to benefit from that. Very good. So, the stretches help you a lot in the releasing the pain on the legs. But if we don't really get better after like a couple of months of doing that, plus the core strengthening exercises, you might need to consult your therapist or orthopedist again. You already consulted before that, remember? So you already know that these are appropriate for you. And now if you don't get better, you might need another set of treatment or different kind of treatment. If you're so inflamed, you might not be able to tolerate all of this. You might need ultrasound, ice therapy, massage therapy, and all of